Section 1. Introduction to Erectile Dysfunction, ED. What is erectile dysfunction? Erectile dysfunction, commonly referred to as ED, is a consistent or recurrent inability to achieve or maintain an erection firm enough for satisfactory sexual intercourse. It is not unusual for men to experience occasional difficulty with erections due to stress, fatigue, or other short-term issues. However, when the problem becomes persistent, it can be a sign of a deeper underlying issue, either physical, psychological, or both. ED is not just a bedroom issue. It's a medical condition that affects a man's overall quality of life, emotional well-being, self-esteem, and even relationships. The good news is that ED is treatable at any age, and in many cases, reversible with the right approach. Understanding the scope. How common is ED? ED is extremely common. According to research, around 30 million men in the United States are affected by some degree of erectile dysfunction. By age 40, about 40% of men experience ED. That number jumps to 70% by age 70. It's not just an older man's issue. A significant number of men in their 20s, 30s, and 40s report ED-related symptoms, often caused by psychological factors, poor lifestyle habits, or even overexposure to pornography. What this means is, if you're struggling with ED, you're far from alone. Types of erectile dysfunction. ED isn't a one-size-fits-all condition. Understanding the different types can help in determining the best course of treatment. 1. Occasional ED happens from time to time, often due to temporary stress, fatigue, or alcohol use. 2. Situational ED occurs only in specific situations, such as with certain partner or under performance pressure. 3. Chronic ED, regular and persistent, often requiring medical attention or deeper intervention. Each type has its root causes, and responding effectively begins with identifying what kind you're dealing with. Myths versus fact about ED. There's a lot of misinformation surrounding ED. Here's a breakdown of common myths and the reality. Dispelling myths is a first step in reducing the shame many men feel, which in itself can worsen ED. Why erectile dysfunction matters beyond the bedroom. Many men delay dealing with ED because they view it as just a sex problem. But ED can be a red flag for serious health issues. Since erections rely on proper blood flow, hormonal balance, and nervous system function, trouble in these areas can point to cardiovascular disease, type 2 diabetes, high blood pressure, high cholesterol, obesity, hormonal imbalances, e.g., low testosterone. In some cases, ED may be the first noticeable symptom of heart disease, making a potentially life-saving clue if addressed early. Moreover, the emotional toll of ED is significant. Self-esteem and identity issues. Men often tie their sense of masculinity to sexual performance. ED can create feelings of inadequacy or failure. Relationship strain. ED can lead to distance or misunderstandings between partners, especially if communication breaks down. Mental health effects. Ongoing ED can trigger or worsen depression, anxiety, and social withdrawal. Understanding that ED isn't a minor inconvenience, but a holistic health issue is essential to treating it effectively. ED as a reversible condition. The narrative around ED is often defeatist. Many believe once it starts, it's a permanent decline. In reality, many cases of ED are reversible, especially those not linked to permanent nerve damage or severe chronic disease. Reversible causes include lifestyle choices, e.g., poor diet, inactivity, alcohol. Psychological patterns, e.g., performance anxiety. Medication side effects. Hormonal fluctuations. When these underlying causes are identified and addressed, many men find that their ability to achieve and maintain erections returns naturally, often without long-term medication. The silent struggle, why men don't talk about it. Despite how common ED is, it remains one of the most underreported and undertreated health issues in men. Why? Shame and stigma. Society often equates male worth with virility. Lack of information. Men may not know ED can be linked to treatable medical issues. Fear of medical interventions. Concerns about invasive procedures, side effects, or dependency on medication can prevent men from seeking help. Relationship worries. Some fear rejection or judgment from partners. The silence only compounds the problem. But opening up about ED, whether to a partner, doctor, or therapist, is a first step toward resolution. The ED recovery mindset. Solving ED starts with the right mindset. You are not broken. ED is a condition, not a character flaw or failure. You are not alone. Millions of men go through this. You can improve. With the right strategy, support, and consistency, your sexual health can rebound, often stronger than before. Like any recovery, healing from ED is not always linear. It may involve trial and error, setbacks, and patience. But the process is deeply empowering, as it involves not only restoring sexual function, but also reclaiming control over your physical and mental health. What's coming next? Now that we defined ED, explore its scope, and address common misconceptions, the next section will go deeper into the causes of ED, physical, psychological, and lifestyle-related. Understanding these root causes is a foundation of every successful ED recovery plan. Would you like me to go ahead and draft Section 2, Causes of ED, 500 words? Next? Let me know if you'd like that, or if you want this current section as a downloadable file too.